Hi everyone, I'm Emily Rossman and I had case study 76, which discusses systemic lupus erythematosus. Patient Abby Boone is a 47-year-old white female with an 18-year medical history of systemic lupus erythematosus, or just lupus. Overall, the patient has an unremarkable history and has had no allergies. Abby takes the occasional naproxen for joint pain and antacids for heartburn. Other than that, she's not taking any over-the-counter medications. Abby is 5 feet and 5 inches tall and weighs approximately 102 pounds. The patient's BMI is 17, which is categorized as underweight. The patient has lost 23 pounds since her last checkup, which was about a year ago. Abby's older sister has rheumatoid arthritis and her aunt has pernicious anemia. Likewise, her deceased mother had suffered from Graves' disease, which is an autoimmune disease involving the thyroid. It is very common for someone with lupus to have relatives with an autoimmune disorder. About 18 years ago, Abby first began noticing multiple rashes that would develop on her extremities and she would lose patches of her hair. She attributed these symptoms to stress. In addition, the patient noticed that she lacked energy and began to feel arthritic pain in her fingers and elbows. In addition, at this time, the patient's erythrocyte sedimentation rate, or ESR, was 25 milliliters per hour. An ESR is a test used to measure how much inflammation is in the body. Women under the age of 50, like Abby, are supposed to have an ESR of anything that is below 20 milliliters per hour, but patients with autoimmune disorders typically have an ESR that is higher. During the physical examination, the doctor discovered several rashes on sun-exposed areas, such as her arms and legs. A tissue biopsy was also performed and revealed the patient had vasculitis, which is inflammation of the blood vessels. In addition, Abby's antibody test or anti-nuclear antibody test came back positive. This means the patient has an autoimmune disorder. The patient's heart, lymph nodes, and lungs had normal findings, but her blood test revealed a low hematocrit level at 23%, a low red blood cell level at 3.5 million per microliter, and the normal ranges for red blood cells is 4.3 to 6.2 million per microliter for females. However, the patient's white blood cell and platelet levels appeared normal. Likewise, Abby appeared slightly jaundiced, and her blood smear showed that her red blood cells were normal in shape, size, and color, which eliminated several vitamin and mineral deficiencies. The patient's urine analysis was normal, and the patient was then placed on prednisone for several months, and she had no signs and symptoms of lupus for a while. 5 years ago, Abby confronted her doctor complaining of a cough and stiffness in her hands that came and went. Likewise, the patient's lymph nodes were slightly enlarged, her blood pressure was 140/90, which is high, and her temperature was also high at 100 degrees. Her lungs revealed mild pulmonary edema or fluid within the lungs, but there were no white blood cells found in the airways. The doctor was concerned about Abby's susceptibility to acquiring pneumonia. The patient was given an antibiotic for 10 days to prevent pneumonia, and she was also placed back on prednisone. All the patient's signs and symptoms resolved quickly within 3 months. Today, Abby returned to her physician feeling extremely fatigued. She also complained of weight loss, anorexia, and severe swelling in the abdomen, face, and ankles. Her physician notices the butterfly-shaped rash on the patient's face, across her nose, and cheeks. Abby's blood tests reveal a low hematocrit level of 24% and a white blood cell count of 2,400 microliters. Her urine analysis shows there is abnormal protein concentration, and a microscopy shows increased number of red blood cells and white blood cells. She excreted approximately 2.5 grams of protein in 24 hours. In conclusion, the patient seems to be suffering from a bout of her lupus. Systemic lupus erythematosus is an autoimmune disease that becomes symptomatic when the immune system attacks native tissues.